Sari will start our session.
Hello, good morning. And welcome to this session to all the audience and participants in this meeting. And it's my pleasure to introduce our presenter and the topic for today as tooth shame. Our discussion will be led by work from Professor Esben Øzhayat from the University of Copenhagen. Professor Øzhayat is a leading voice in community dentistry who is actively shaping the field of dental public health and is as a leader for this section in the University of Copenhagen. His research critically examines the social and psychological dimensions of oral health, moving beyond just clinical routine treatments. And today we'll be engaging in with the ethnographic paper entitled Tooth Shame, an ethnographic study of the choreographies of tooth shame in Danish elderly care. And this study ventures into sensitive, vital areas of geriatric care. It introduces the powerful concept of tooth shame. And actually, it is a very new term in the field of dentistry, and it's very interesting. And he argues this topic as a collective phenomenon that actively disrupts care practices and social well-being. And it's my pleasure to welcome our colleague also, Dr. Ms. Choreographies. She presents the outline of the paper briefly, and then we deeply discuss the content of the paper all together. Dr. Choreographies, please start.
Thank you, Professor Hesari. Good morning, everyone, and thank you for joining today's Journal Club session. We are very pleased to have Esben with us. Hello, Esben. A very warm welcome to you. I know that you have a very busy schedule, so thank you so much for accepting my invitation and taking the time to join us this morning. Today we will focus on the topic of dental shame. I will share my slides. Today we will focus on the topic of dental shame. Esben, in our previous journal club, we discussed your commentary article on dental shame, a call for understanding and addressing the role of shame in oral health, which sparked a very interesting and engaging conversation among our group. It felt natural for us to invite you to join a session in person, so I am really happy to have you here today. I will start with a brief overview of this paper titled Tooth Shame and Ethnographic Study of the Choreographies of Tooth Shame in Danish Elderly Care. And then we will open the discussion. The plan is to have a short presentation and followed by a group discussion and your insights in the following session. If that sounds good to everyone, we can get started.
Perfect.
This paper's central topic is tooth shame and addresses a critical issue, the poor oral health of older adults in care. The authors argue that beyond the physical problems, there is a powerful emotional experience that uh, the term tooth shame is defined. This is not just about feeling embarrassed. It's a deep-seated shame related to one's teeth that affects self-worth and social interactions. The study points that this shame is not just an individual's problem, but something that spreads between people and interferes with care itself. To understand this complex phenomenon, the researchers conducted an in-depth ethnographic study. They didn't just rely on interviews, they spent significant time observing daily life in care units. This method was crucial because shame is often nonverbal. It's hidden in body language and the tone of voice and what people don't say. This approach allowed them to see the full picture of tooth shame in their elderly people they were observing them. The paper's central analytical framework uses the powerful metaphor of choreography. The authors argue that tooth shame is not static. It's performed through a set of behaviors. They compare it to rings spreading in water, starting from one individual and expanding to affect everyone around them, creating complex and often damaging patterns. The first key finding details what they call adaptive choreographies. These are the ways individuals cope with and hide their tooth shame. We see people physically hiding their mouth, withdrawing from social life to avoid being seen, and verbally blaming themselves for their dental problems. An example from the paper is a man named Steen who said he simply stopped smiling for years because of his teeth. These adaptations directly lead to social isolation and avoidance of necessary care. Tooth shame doesn't stay with the individuals, it's collectively distributed. The study shows how family members feel guilty for not intervening and how care workers find dental care intimidating and avoid it to protect the residents' dignity and sometimes to protect themselves from an uncomfortable situation. This creates a short tense atmosphere where the shame is felt by everyone involved. Finally, and perhaps most critically, tooth shame actively interferes with the core system itself. It becomes embedded in routines, care workers wanting to respect a resident's autonomy often don't insist on providing help with brushing, even when they know it's needed. This creates a double bind. They feel ashamed either for not providing care for in residents' privacy. The result is that vital preventive care is skipped when can lead to serious health issues like pneumonia. Uh, In conclusion, this study established tooth shame as a significant and damaging force in elderly care. It's both a cause and an effect of poor oral health, creating a vicious cycle. The authors called for practical interventions such as training care workers to be shame sensitive and for more research to understand this complex phenomenon fully. This paper forces us to look beyond the toothbrush and see the profound emotional and social dimensions of oral health. I gave a very short overview of this paper. All the members of this journal club have read the paper before, and I think now we can open the discussion. And at first, I want to Professor Hesari, if you have any particular comment on this, and then we can have Esben's reflection on this study.
Thank you, Sogoli. That was very nice, short presentation. And as we planned for that, the presentation was very short, and then we are ready to hear Esben's lecture or speaks. But first, I would like to welcome to Professor Heikki Mortoma and other colleagues that are with us in this meeting, and we are very happy to have him and other guests. Okay, Esben, the session is ready for you. Thank you.
Well, thank you very much, Dr. Hazadi, and thank you also, Sogoli, for this very, very precise, actually very precise summary of our publication. It's a big publication. I don't know. To me, it is a very difficult publication to read. Actually, I don't know how you if it was easy for you to read, but this is a very large publication with a totally different approach of writing a publication. So I can give you a little bit just run through our thoughts about this publication and how it was done and so on. But I would also very much like it to be open for discussion. So if you have anything you want to ask or comment, I would be more than happy to do that rather than just me talking, because I think when I'm here, and thank you for inviting me. I'm very glad to be here. I'm also very curious, and I also want to learn something about your point of view on this topic because it is a new topic. So I would very much like to know if this is something you can recognize or if it's totally nonsense to you. So I would like to discuss that. Yeah. So
Could you please first open the session with the explaining what is actually tooth shame is and how it interacts with our normal life, routine life, and what was your experience when you were or your colleagues were in the this elderly residence for many days? What was your feeling about that?
Thank you, Dr. Sade, for this. Actually, we did not go into the nursing homes and the home care and talk to the citizens with the idea to conceptualize tooth shame. So we went out because this is a part of a large project called Lifelong Oral Health, and we wanted to improve oral health in older people. I don't know how it is in your region or your countries, but in Denmark, the oral health of the elderly people is not very good. So we wanted to improve that, but before we could do that, we needed to go out and find out what's the problem. And then during the observations, the interviews, and so on, this concept of tooth shame slowly emerged from the ethnographic data, actually. So it was my PhD student, Louise, who went out and did all the observations and all the interviews. And she found out that when she asked these people, "How are your teeth?" What do you think they answered? "They're good. No problem. I have no problem with my teeth." But she could see that they were doing like this and they couldn't chew, and so she kept asking, and then at some point all these stories about shame, they came. So we had many stories about this shame. We had a woman who was in a nursing home, and every time the dental care they came, she left. She went to the bus stop and she was sitting there. And when the dental care they left the nursing home, she came back. So so there was so many and why did she do that? Because she didn't want anybody to look into her to her mouth. She had poor teeth. She didn't want to have anybody look at that. And this is what when we're talking about tooth shame, it is something that the individual can feel. So being ashamed of your teeth, and I think we can all agree that this is a thing. But we when we go into shame, it was very precisely what you said, Sogoli. This is not something you talk about. This is something you see, something you observe, and it spreads to the care workers. Because I mean, I don't know how it is in your countries, but in Denmark, if you have problems taking care of your own teeth, then there are some care workers who could help you. But they didn't want to go and talk to these older people about their teeth because they were so afraid of inducing this shame. So they asked, "Can you take care of your teeth?" And the older people said, "Yes, yes, no problem." But they really couldn't. But then they didn't do anything else because they didn't want to go into that shame feeling. So in reality, shame or tooth shame or dental shame, it can both be actually a good thing because if you have shame about your teeth, then maybe you want to do something about it. But shame can also induce a behavior where you want to avoid the shame inducing things. So you don't want to go to the dentist. Maybe you don't brush your teeth, and you're being told you shouldn't eat sugar, but you still keep on eating sugar because you have this shame. So it's a downward spiral of shame and then poor oral health. So we didn't actually had a plan to conceptualize tooth shame. This was just something that came up in the ethnographic work, and this is how it is when you work with very professional ethnographic professionals. They are very good, and they do a cultural analysis, I'm a dentist, so I was I was not skeptic, but I was curious and really, okay, how are you gonna talk to these people? What are you gonna find out? And this tooth shame was something that when we conceptualized it, we we told actually the care staff, we told all the municipalities that are in this project, we told them, "Oh, we found that there are this tooth shame, and the older people, they have some shame, and it also spreads to the care workers, so there's some shame in the relationship." And they were like, whoa, this is exactly what's going on. This is exactly what's going on. And they started actually working with this shame. So what we want to do, you talked about some shame sensitive approaches, Sugoli, but just talking about oral health with these older people, they didn't do that. So now they've started talking to these older people about their oral health. And if the older people says, no, this is not a problem, then they just slowly work with them and talk to them. And then at some point, they maybe are allowed to help them. Hmm. So this is the story. And as I said, this is not an easy publication to read by any means, I think, because I'm a dentist. I don't know what is it all dentists here, or is it other professions as well?
Yes, yes, they're all dentists or
All
here.
dentists. Okay, yeah. Then I guess you had some issues reading this publication because this was my PhD student who was writing it together with some collaborators. And every time I had to read it, I was spending hours and hours reading it because it was very difficult because it's another tradition, right? They have a lot of names, so they they write a lot of names and theories and stuff like that. So it's just another way of writing publication, but it opened my eyes. It opened my eyes towards okay, you can also do research and publications in a totally different way. And actually, I think this is some of the most meaningful research I've been involved in to conceptualize this tooth chain because I really do think that it can open up some new approaches to handle oral health, especially in people in some vulnerable situations.
Okay, thank you. And just one small question, and then ask other people if they have any other question. When you started to uh, run this study, that's a question that I want to know. Did you know the term tooth shame, or did you think about this term for the title of your paper? I mean that did you know that you are studying on tooth shame, or you selected this title for the paper later on after you started the or finished the study?
We did not have any idea when we started the study that we were going to write a paper on tooth shame. This was just something that came about in the ethnographic work. So, and we discussed it very much. Should it be tooth shame, dental shame, oral health related shame? What should it be? And we ended up with, for this publication, it's tooth shame because we think that saying tooth shame is really a nice way to just it's a nice term. Everybody can understand tooth shame. But then for the comment article, we decided on dental shame because then you have something about its dental anxiety and dental. I mean, it's a more like broad term. But I think tooth shame was the term we chose for this article. But we didn't know beforehand. This was just something that we decided upon.
Because you introduced a new term to the dental terminology tooth shame. Thank you. Okay, Sogoli, if you have any other question, please.
Thank you. Yes, I agree with Esben. For me, it was very difficult to read this article and summarizing in these short slides. It was very extensive and has many aspects, but we had a time limit and but it was very difficult for me. And I agree with you, Esben. It was very interesting for me the choice of ethnography and it was clearly central to uncovering the nonverbal and choreographed aspects of shame. Could you speak to a specific moment in the field where participants' observation gave you insight that interviews alone would not completely show us the different aspects of the shame. The field note about Birte was a powerful example of the ethnographic being drawn into the collective choreographies of the shame. How did you or your researcher uh, uh, manage your own emotional in responses and potential feelings of shame or guilt throughout the research process? And how did this reflect on practice on the analysis?
So just so I understand the question correct, Sagole, so when in the fieldwork we started focusing on tooth shame, was that the question? Yeah. Okay. So
Yeah.
I think that Louise, the PhD student who was doing the field work, she was talking to a lot of older people, and everybody said no problem, no problem. And she was starting to get a little bit frustrated actually because she said, "But come on, I can see there are problems. Why aren't you telling me something about this?" And then I think actually this Steen person, the initial quote from Steen, this was a defining point from her because finally someone opened up and said, "Well, not everything is fine. I've been ashamed about this for years. This is something that's been bothering me for many years, and it came to social isolation, as you said." So, and when she kind of then okay, this was the lens she opened up, and then in the following interviews and all the other observations, she started slowly focusing in on this, and then also talking to the care personnel. This was part. But what was really interesting is that in the nursing home, they were the care personnel. They said you have to be aware. These people, they do not want to talk to you. They have enough on their plate. They don't want to talk to you. But you know what happened? They lined up for interviews with her. They all want to tell their story to her. And this is what ethnography can do. This is about stories, right? And when she started learning these people and knowing them and asking the right questions, then everything came out. So I think using ethnography, as you said, is a key here. And I think it also shows that, let's say you're working in a nursing home or whatever, and you're asking, so do you have any problems with your teeth? Then the answer will be no, no problem. But we know now that if you kind of continue asking and stuff like that, you might get another response.
Yeah, thank you. Now we have a time limit. I want my colleague Tina, who has a question about this paper. Um Dr. Hasari, I think you should grant access to Tina.
Hi, Esben. I'm Tina, one of the PhD candidates here. So thank you for your wonderful presentation. We learned so much, specifically about tooth shame. It's a very new topic for many people like me. I basically never knew such a topic existed before. So your study had a very brilliant framework for tooth shame in Danish context. So my question is, if we want to conduct a research and study similar to yours in our country, where DMFT and the issues like that are very much worse compared to your country, what should be done, and what do you suggest we do in order to adapt such a research in our country as well? Thank you.
Thank you, Tina. Thank you for the question. I think it's a brilliant question.
I
think there's something with the sound. Okay, I think maybe better now. So thank you, Tina, for the question. I think it's a brilliant question because we are just scratching the surface of this topic right now. We've just introduced it. So trying to find out if this at all makes sense in other settings would be a very good idea. So if you have, I mean, the oral health in the, as I said, in the older Danish people are not very good. So they have a lot of problems as well. So I can't see why it should be much different in your countries. But I think there's a lot of culture also. I think there's a lot of who do you kind of compare yourself with? Because in general in Denmark, the oral health is very good actually. So there's a lot of stigma because then if you have your poor teeth, who do you compare yourself to? So I would be very curious and very interested to learn if this concept of tooth shame would be relevant in a population where the oral health maybe is not so good. Are there still shame, or is the shame not so much? So I think shame, as I understand it, and I've been working with some shame researchers now, they say shame cannot be measured. And this is very difficult for us as dentists to understand. So the moment I said, "Oh, we have tooth shame. Now we want to do some questionnaires on tooth shame. We want to how to measure tooth shame," and the shame researchers they said, "No, no, 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 no. Shame cannot be measured because you will never answer truly on these questions." So I think you need to do some sort of qualitative investigations to find out if shame is an issue in your population. Would be a good way to start, I think, at least.
Thank you, Ina, for your question. I want to say something about your response. So you think that in dental field it is very soon to measure by qualitative methods about shame, and we should do more qualitative studies, and it is soon for quantify the shame, and for example, the frequency of hiding the mouth or something like this, we can measure for this.
Yeah, you can then it's more like an objective measure. But I mean, I think for dentists, me included, I've done a lot of quantitative research. We want to measure everything. If we can measure it, then we know it's true. But I think, at least for me and my eyes now, I've been opened up a little bit more about the qualitative approach, where I think we can get much more information and better information, because you will only get the answer of what you're asking if you're doing the quantitative research.
And I think our guest Morenike, our friend from Africa, has one question. Dr. Hesari, I think you should give her access.
I can see her.
Thank you. Thank you. Thanks for giving me audience. Yes, like you noted, the topic is extremely interesting, but I want to kind of corroborate what you're saying. I had a study that I was looking at cultural influence on dental service utilization here in Nigeria, and I focused on a ethnographic group. And you know what I found? Exactly. I didn't write it up as dental shame, but I did write that there was stigma. And what happens is that the culture gives significant attention to oral health. So for those that have poor oral health, they kind of hide. They don't want it to be known. So that keeps them away. They do a lot of household remedies and only get to the dental clinic when things are very late. And I got to study that because in my country, forever, since I was a student, it's always, oh, patients are not coming to the hospital. They always come late. So I decided to study. I mean, there must be a reason why they aren't coming late. This is about 30, 40 years of my profession, and it's still the same story. So I do agree with you that I think maybe it would be nice for people who are interested in studying this coming together to understand. I do not think shame cannot be measured. I think even qualitatively, you can measure it using rubrics as a start, which is qualitative data pulled together in some way. But yes, I think if more people do studies, we probably would find out. It might now vary between communities, and yes, I think there's a cultural influence to it. But yes, there's something. Yeah. Okay, thank you.
Thank you, Monique.
Thank you, Monica. And one of my colleagues, Monira, has also a question. Esben, Dr. Hasari, please give her.
Hello and good morning. Thank you, dear Esben, for attending this session. Your presence is truly valuable to us. At first, I'm eager to know more about the caregivers. I want to know about their story because you mentioned that care workers may experience tooth shame on their own behalf, but you didn't have enough material to explore that. This seems like a rich and important area. What would a research design look like that specifically investigated the intersectional shame of care workers? I want to know more about them.
Yeah, yes. I agree that they are very important and they play some part in this publication. We've just, or actually my PhD student Louise has written another publication about dental disgust. And this publication, it goes into the care workers and how they experience performing oral health in older people. And there are also aspects of shame in that, but she's chosen the term dental disgust because they explained how they think it's very difficult and actually a little bit disgusting maybe to perform oral health in older people. As dentists, we do not understand this because come on, brushing the teeth, how difficult can it be? It is very difficult for these people. For them, in at least in Denmark, it's much easier for them to change the diaper than to brush the teeth in older people. So I think this is very important to know. And I think you are completely right. If you want to do more studies on these, I think again I would suggest qualitative research to find out what's up and what's down in their view. And this is what we've also done in our study. And yeah, if you want to know more, I would recommend reading the Dental Disgust article. But I have to warn you, it's a very difficult publication to read, just as the one on tooth shame. It's an ethnographic publication, but it goes into the care workers' approach. And soon, hopefully, we'll have another publication where we are trying to have the dental care and the care personals kind of approaches and views up against each other, because there are very different approaches going on. But it's very interesting to see how the view of the care persons, it's a holistic view. So they know oral health is important, but everything is important. So what is not important if you are taking care of an older person? It's a good question, right? Whereas the dental care, they say you have to brush the teeth, you have to brush the teeth, and they say when, how, it's not possible. So I mean, at least in Denmark, it's a very strict time issue for these care workers.
Okay, thank you. And right now, I would like to ask Professor Heikki Murtoma, invites him if has any word or question. Is our pleasure to have him.
I think he's disconnected now.
Oh, okay, so Professor Khami, if you have any question or anything to, okay.
Yes, okay, thank you very much. Can you hear me? Yes, okay. Yes, first of all, I want to thank Esben for being with us in this journal club. I think it is a very fruitful discussion on a newly emerged maybe topic. I think there is a room for working on this issue in our country. We know that our population is getting older, and this is the population trend. And studies show that the oral health status of elderlies in Iran is not so good. So the indices show that it is not very good. And of course, this tooth shame would be another problem. And it put burdens on the life of the elderly people. So I think it is a very good opening for this topic to be elaborated maybe in our department or other departments of community oral health in Iran, those who are working on oral health of the population, specifically those who are working on elderly population. And so thank you, Esben. I think it was a very good opening, and I would like to invite you to. I think this is just a start, and we would be happy to have you in our future meetings. And specifically, I want to invite you to be with us in our Congress, annual Congress of Iranian Community Oral Health Association, which we have an online part for that, to a discussion panel, and it would be on December 24, I think, December 24. Of course, we will send you a formal invitation, but I know it might be a little bit late, but it would be very nice if we could have you in our Congress. Thank you again, and I would like also thank Hossein and Sogoli for this journal club.
Thank you, Mohammed, and other participants. If you have any question or talk, please, Dr. Mohammed, Professor Mohammed.
Hello, everybody. Thank you, dear Professor Esben, for the nice work, and thank you, Sogoli and Dr. Hesari, for doing this nice job. I would like to ask you about what do you think about measuring this dental shame in other age groups? For example, children or younger adults.
Thank you for the question. And again, I would like to stress that it's difficult to measure dental shame and tooth shame, but I think exploring tooth shame in young people would be very interesting. Again, in different populations and to find out if this, I mean, if you're a teenager. In Denmark, at least, if you're a teenager, you have a lot of shame, I think. So if you have some issues with your oral health, how would that interfere with your social life, which is very important at that age, right? So I think it's a very good opportunity to see how does that affect the social life of teenagers, for instance. And I think also in not older people, but just adults in general, how do they function in their everyday life? If do they have a job? Does it affect their job opportunities and stuff like that is very important.
Yes, thank you. And I was just curious that what is your next step, for example, in your own, what is the
Yeah.
real world implication for your work or the next steps, if you can explain a bit?
Yeah, we have two approaches now. One is continue in the older people, where we've kind of made some approaches that we want to spread to the rest of our country, maybe even other countries. So this is the first one. The second one is we want to go into people in socially vulnerable situations. So homeless people living in shelters, people in difficult situations. People
Yes.
without jobs to find out what happens if we start helping them with their teeth and improving their teeth. Does it make any difference for their shame?
Yes. Thank you very much, Professor.
Thank you. Any other question? Okay, I want to have another question that regarding to the definition of oral health, which aspects actually tooth shame refers to, and which feature of oral health definition is related to tooth shame?
But I think going into the definition of oral health, you should also just look at the definition of health in general, right? So the definition of health it's not just absence of disease. It's also well-being and stuff like that. And I think tooth shame is kind of in between these two aspects of health because it is a psychological kind of thing, but it can actually be detrimental for your physical oral health. So I think it relates to both parts of oral health. But it is the subjective part of the oral health definition, but it can have effect on the more objective measures.
Um, Thank you, Esben. I know that you have another meeting, and I promise you that our session will take just 45 minutes. And I think it's over. And if anyone doesn't have any question, nobody. Okay. Thank you for.
I think we can take a group photo. Anyone who
Yes,
can open
yes,
the camera, then it would be nice if we take a group photo.
yes. I want everyone to open their camera. One,
Okay.
2,
Okay.
and 3. And one more time. Okay, one more time. Another picture. 1, 2, and 3. Okay. Thank you. Thank you, everybody, for being here today. I think it was a thoughtful discussion. And Esben, a special thanks to you for joining us today. I hope today's session encourage all of us to think more openly about the emotional and social sides of oral health. Thank you again. And we see it's snart i Copenhagen. And have a really nice afternoon.
Yeah, thank you. And thank you very much for inviting me. I'm very impressed by this journal club. It's a very good job you're doing. So congratulations on that. And have a nice day, everybody.
Thank you.
Thank
Thank you
you.
very much.
Thank you, Esben, and goodbye to everybody.
Bye-bye.
Mm.